So Nico started us off this morning, right, with the comparison to how the journalism industry has decreased to an even larger extent than the steel industry. And part of what we have represented here, right, when you put together a conversation like this, you can't have all the people who no longer work in the field, right? So we're pretty blessed, and I'm also obviously super excited to have an all-women panel. Which is fantastic, right? Yeah. I think there'll be a manel tomorrow, so whatever the female version of that is will be today. But Lena, I'm wondering if you could share a little bit. And the reason why I want to dwell on this just a little bit is because if we see that part of the connection between traditional journalism and junk news is audience engagement, right? And for everybody who is still in traditional media, audience engagement is sort of the bread and butter right now. We need to find out how to get people to come to these sites and to consume our work so that we can continue to pay for it. So Lena, I was going to ask you to talk a little bit, if you can, about how the Washington Post thinks about this and what that means for you specifically in terms of covering these diseases.
So audience engagement is foremost at the leadership of my news organization. If you come to the Washington Post these days, the main newsroom is this big hub, high open ceiling area, and across one side of the news, one side of hanging from the top is this enormous screen, tells you in real time what everybody is reading, and you see how that curve goes up in the morning, it spikes around noon, and it comes down in the afternoon, and then picks up again in the evening. At any one time, it'll show you what is the top story. So obviously during the election, Trump-related stuff, but you remember when that man was pulled off the United Airline flight, right? Everybody remembers that story? There were so many people reading about that, that was even above the homepage. It was way at the top of the screen. And it is something that we have all these different teams of metrics, and people know when you read the story, at what point in the story you're dropping off, what kinds of stories interest you. And as everybody has said, there is no business model for us in journalism, right? We don't know what is the best way to work. At the Post, we try to do the best journalism, hold people accountable, and but they do also want to get subscribers, because our print edition is, used to be way up here when I first started, and it's slowly eking out. And at some point, there won't be a print edition, but right now there is. They want digital subscribers. And what do digital subscribers want to read? They don't want to read the clickbait about the dancing bears or the shark in the street or the latest whatever. They care about Roy Moore and what his past was. They care about the Russia investigation. They care about the deeply reported stories that take a lot of resources to do, but which the Post and a bunch of other places are still committed to doing. And the Congo story that I told you, I was out of the office for a week and over a week, the photographer, then it was custom designed, not just to appear on the Washington Post site, but also on the Apple News site to reach a broader audience. And it had a very strong engagement, and over 20% of the people who engaged with that were digital subscribers, and that's the holy grail. It is tough. When I first started in journalism decades ago, very different tempo to my day. I had one deadline in the afternoon, and not anymore. I may not write as much as these guys, but I have to monitor Twitter and all these other social media streams, and I have to be aware of all our other platforms. We have something that we've launched, the Lily, to try to reach young women. All of the Washington Post photographs and bios of reporters are now uniform, so people know who we are, because you combat disinformation by providing transparency. We try to include as many links as possible to the actual government documents or reports, so people know that we're credible when we're citing the information. We try to explain in the story how we got the information. And we also try to appeal in as many ways as possible to all the different platforms. Instagram, we started something called Stamp, which is only to be viewed on the mobile phone in a vertical mode, and it's very visual images with just a little bit of text. So for the wildfire story, and take Washington Post journalism and to reach a broader audience. And we are in the black, which is great, and we're just hoping that this will continue.
Fantastic, thank you, Lena. So let's move over a little bit to specifically covering infectious diseases. Could you share with us, and I'll let you take the question, Michaeleen, you too, what makes this a heartbeat? What are some of the things that you struggle with as you...
The queen of infectious disease would be Helen.
I didn't say it.
I said it.
I guess the hardest thing is that when something becomes really big, everybody jumps on, and it's really hard to find people to talk to. I have a good electronic Rolodex, but when everybody in the world is trying to talk to the same 10 or 20 people, it's just really hard to get through sometimes. And that, I can know a lot of flu scientists, but in April and early May of 2009, it was really hard to get anybody on the phone, and that, I think, that's the challenge that would come to mind for me.
Do you get, sorry, just a follow-up question, do you get booted out for if Good Morning America or some big network, wants to put somebody on or wants to have...
Yeah, that I imagine that does happen. You just get a different time, It's like, oh, he's not available yet. He'll be available a little later. Yeah.
I would like to say that on the briefings for the WHO, Helen is always the first one to get picked on for the question.
That isn't, they don't pick me. I get on and I dial in the code immediately. That's the secret.
But I think in general, we were talking about news and how quickly and trustworthiness, right? So we don't know independently how big the thing is or who the index case was or where it started or how contagious. We have to rely on the folks who are most in charge and most knowledgeable. And there is a huge lag between government understanding or even a bureaucracy's understanding of that need. If you go to any sort of simulations of pandemics or epidemics, there's a lot of stuff about who's in the room. Just on a regular basis, getting information from the CDC has to clear so many different levels for a non-controversial thing. Yeah. So God forbid what they will do when we have a real epidemic, a real pandemic, which of course we will.
So this morning, when the public health thing announced that they had a third case of monkeypox, that a healthcare worker there had contracted it from one of these two imported cases, my editor has been sort of watching the monkeypox thing, and he said, the next time there's a case, you're going to have to write. And so I got an email at 7:05 this morning saying, I think it's time to write about monkeypox. And I said, okay, but you have me for about 3 hours this morning, so I can only do X. I was going to do like a Q&A. And I reached out immediately to a very good public information officer at the CDC, who you will know who I'm talking about,
yes,
who's excellent at his job, and said, can I get somebody fast? I need it this morning. I need it, before 10. I have to write this story because then I have to go to this panel. And he just got back to me and said, the clearances would never come through in that time frame. Sorry. If you need it on the record, it won't happen.
Yeah.
Didn't happen.
Yep. So this is just like one small microcosm of what it's like in the U.S. government, right? This is the agency and it's the agency that's in charge, and this is not even that big a deal,
yeah,
right? So there's that frustration. In the meanwhile, you could imagine a scenario where some not reputable junkie kind of site is taking rumors from what the nurse overheard in the hallway telling her boyfriend, and off it goes, and then you have, hysteria.
Yeah. Indeed. Aaron, do you have?
Can I say something about that? Sorry.
Yes.
I think for me, coming from a scientist, so I spent 7 years in academia and then I switched to this crazy media world. For me, the hardest part of this is the politicalization, is that a word? The politics that gets involved with the science. So during these outbreaks, like the Zika sticks out in my mind, there was a lot of politics mixed in with like what the CDC was telling us. And it wasn't always just what the data were saying. You always kind of have to read between the lines, like what is their political agenda, and how does that sway what they're saying? And as a scientist, that's really hard for me. It still is, because it's like I want to know what's going on. I want to know what the kind of the facts are, and we don't as reporters always get that from government agencies and pharmaceutical companies. And scientists, I think, are a little bit more straightforward, but they have their own biases. But for me, that's been really hard. It's like even when you get the CDC, I'm always a little bit like, what is their agenda?
Thank you, Michaeleen.
So my perspective is a little bit different. Again, as a freelancer, I covered Ebola for National Geographic, and part of their motivation is always to showcase their fabulous photography, which I actually love. My stories looked fabulous on that website because they had such gorgeous pictures. But so I wasn't trying to be the definitive reporter on that story. I was trying to take kind of a more perspective, step back angle, which is pretty hard from my living room in Cambridge to do about West Africa. So I spent a lot of time trying to track people down in the real world on the ground there. And one story I ended up being really proud of, but it took me forever to try to, I did a piece about orphans, the kids who'd been orphaned by this horrible epidemic. And I ended up finding a family who had taken in this kid who'd been their neighbor, and the mother died, and their neighbor took them in, and it was really a very moving story to me. But it was quite challenging. They had these Liberians. They had this very thick accent. They spoke English, but I was on the phone, and I was, oh my God, what are you saying? I have no idea. So it took me a little while. The interviewing was really challenging. But it ended up being a story I was really, I thought, added to the discussion, and really enjoyed doing.
Fantastic. So. And we had earlier a question about international reporting, and when we had a history of science conversation last night about these types of perspectives. So Michaeleen, I'm actually going to ask you, and being an international journalist myself, I have spent a lot of time thinking about the implosion within journalism obviously also leads to way fewer people on the ground to do these kinds of stories. And then at the same time, people like Helen and you've all shown us that there are workarounds for these. But exactly, right, there's sort of a shake of a head, right? So Michaeleen, I think you have a story to tell about covering Ebola first from here and then being able to go and do on-the-ground reporting.
Yeah. When I first started working on the Ebola outbreak at the beginning, like we were on it really early, like February, March. Fabia, who was in West Africa, alerted us to it. And for about the first 7 months of it, I was at my desk in San Francisco, where I am right now, covering the science of it, which was really exciting and really interesting. And I think I made really good contributions to the coverage. But then in October, actually, NPR was asking for volunteers to go. People actually didn't want to go. It was like people wanted to kind of stay away from the outbreak. And the people that had gone had been many times, and we were trying to keep people fresh. And so I actually volunteered. I was like, I want to go. I definitely want to go. My husband thought I was crazy. He didn't want me to go. And it really changed how I thought about the epidemic in my mind. It completely shifted, because when I left here, San Francisco, it was October, and it was just when Ebola had come to Dallas, and Chris Christie was quarantining the nurse, and the MSF doctor was getting diagnosed, and there was this like kind of mass hysteria here in the U.S. And then when I fly to Monrovia, it was like there was like no hysteria. So there was like, I come from the place where there's 3 or 4 cases, the place where the outbreak is peaking with thousands and thousands of cases, and people were just moving on with their lives. People were getting their hair cut and hanging out at, bars and watching soccer, and it was just this really different experience. It was like, wow, what we see in the news every day is really not representative of what is actually going on in these places a lot of times. So it was a really has had a profound impact on my thinking of outbreaks. And we actually turned that into a story. So like we wanted to show this, right? That like that this hysteria was not there. That people were moving on with their lives, and there was a normalcy there that really wasn't represented in the coverage that we were seeing on the outbreak. So it shifted my way of thinking about it, but it also helped to like personalize the outbreak. Talking, like Lena said, to the moms, to the families. I think you are able more to then present them in a way that's very relatable and human.
Thank you, Michaeleen. Lena, do you have anything to add about how being able to do the monkeypox story has changed your approach?
I just think that even before monkeypox, I was the Beijing bureau chief for the Washington Post, also a long time ago. There's something about reporting on the ground that is so much more satisfying, and especially for our particularly insular group of Americans who grow up thinking that, the world is only about 26 kinds of Pringles potato chips and only speak one language, that it's so important for us as journalists to be able to report from other places to let Americans see, pull back the blinds. And the other part of it is that what we were doing in Congo was very basic science, but the logistics were just incredible. You could only reach this village by boat. And once we got there, we had to cut down the bamboo from the forest to build the lab. Then they had to go into the forest every day to build the traps to get the animals. They had to hire a local woman to cook the meal. A goat would walk by, and then that goat would be your dinner. But there was only one meal a day. There was no showers. But with the incredible equanimity and composure and not missing a beat when the boat broke or whatever. This is what science does every day, and it was great to be able to show that to Americans as well.
Thank you, Lena. So I'll ask one more question and then I'll hand it over to you, so please get ready to ask. I know you have lots of questions for our colleagues. So already in the last 2 days of Outbreak Week, there have been a lot of references to the media, and I was grateful for Michael earlier to start explaining that it's a little more complex than this one enemy of the people. So if there was one thing you could tell people that you wish people knew about your job or about journalism and how we do, what would it be?
We don't make it up.
Yeah.
We try really hard. It is really hard to get people to talk to you for certain subjects, and we keep trying, and sometimes we can do it in the time that we have, and sometimes we can't. And in the time that we have deadlines where we have to write a story within 2 hours because we need to answer those questions, that is why we try the best, so we only have one source or two sources, or not everybody is named, or it's not the perfect person. It's not perfect. We do the best we can.
Yeah, I would also say, all journalists make mistakes. All humans make mistakes. We hate making mistakes. We do it. We hate it. We fix them if you tell us about them. Exactly. I always tell people, sometimes we get asked, will you show us your story or the story in advance? And it's like, no, we don't do that. But I'll send you a link as soon as it's up, and if you see anything wrong, get back to me, tell me, we'll fix it. Get back to me as soon as possible, because the sooner it's down or fixed, the better it is. You don't want to leave mistakes up, because mistakes engender more mistakes, but we don't try to make mistakes. We try to be perfectly accurate.
Michaeleen, do you have?
Yeah, I mean, I think I try to point out to people that we are writing for like a ginormous range of abilities and informedness, is that a word? Right? So like I always think like I'm writing a story that my mom, who is like knows nothing about diseases, can understand, take something from, maybe enjoy, to, my colleagues at UC Berkeley who study dengue virus. I want to write a story for both of those people, and that's an incredibly hard thing to do, and maybe we miss it, and maybe we miss some of the people in between, but I am definitely trying my best to strike a good medium and to give you something that's useful, factual, and that you want to read. So yeah, we just keep in mind that not every sentence in there is written for the expert, and that sometimes that means generalizing things to a level that people get upset about, I think.
Can I just add something to that? Mm-hmm. Not every story, no story can contain all the facts. That's another thing. It's like, well, why didn't you mention this? It's like, because it's 800 words. I can only mention so much in 800 words.
So questions?
Karen?
Oh, sorry, Karen.
It's fine.
Go ahead.
No, it's fine.
Hi, I'm Leo Liu. I'm one of the editors and moderator for ProMed Mail, program for monitoring emerging diseases. And in covering the Ebola outbreaks in the DRC this year, we've had several instances where cases of hemorrhagic fever were reported in other countries like Uganda, Tanzania, Zambia, and so forth. And I think in every case they turned out to be, something else, mainly
Malaria,
Congo crying hemorrhagic fever. So setting aside the fact that, this other very serious illness is simply discounted as a false alarm in the context of Ebola, I mean, this is a literal example of, if it bleeds, it leads, I guess. So for those of you who are doing, on-the-ground electronic reporting, how do you strike a balance between when you filter through these primary reports coming through social media and so forth, between the sort of, being quick versus being accurate? And do you have your own policy? I mean, we've sort of learned to just wait a day or two to see if there's confirmation rather than jumping on this and reporting it right away.
No, you read about this more.
Sometimes waiting a day or two is not generally an option if you're in the daily media. But I'm blanking on what it was, but very recently there was something and people were reporting and it's like, we don't really feel like it's 100% solid, haven't got confirmation. We did hold off, an hour or two, which is, I guess, maybe our version of a day or two. And eventually, when it became clear that, yes, this was real, I started writing. You just have to do the best you can, assess where the information is coming from, how much you trust the information sources.
I think every news organization, again, has its own, barometer. Mm-hmm. And, we have not been writing about or reporting about the Ebola outbreak in DRC daily, right? We're waiting for when there's a significant development. There was a significant development, it's gotten better, it's gotten worse, and now it seems to be getting worse again. And the level of competition for news and attention at the Washington Post right now, you can sort of imagine, right? So and for our readers as well. So it's just you use your best judgment. I did make the argument to our Africa reporter that it seemed like things were getting worse now in Congo, and it was time to write something to take note of that fact. And so we had a story.
I can add a little bit. So we feel like that we have a really good sources on the ground, places that we go to. So, for instance, there was something bubbling up on ProMed Mail recently about some new disease in Haiti, and it was a very vague thing that popped up on social media, and so we just emailed our sources that we know that are really reliable there and said, hey, what is this? What's going on there? Is this something real? And, they got back to us and said, we don't think this is anything really. We'll let you know. So, I think having like really super reliable people that are there, working there and know the lay of the land and what's going on is like invaluable on this front to kind of weed out and filter out the hype.
I guess I'll jump in here. That's one of the areas where being a freelancer is particularly challenging because I don't have that institutional support. I'm basically totally alone when I report a story.
Right.
And my editor has I can't think of an editor I've worked for who has more expertise than I do, and I don't have that much. So it's a challenge. And again, I'm not covering the way Helen is, on a daily basis. But
I'm not covering it the way, like, I tweet about the Ebola outbreak a ton. But I'm not writing about it daily. I haven't written about it in about a week. Yeah, and I would just say, in reply to all this, that Michaeleen and Lena sort of both come from outfits that have a lot of resources and a lot of reach. You have an Africa correspondent. You guys have Africa correspondents and contacts in Haiti. Many news outlets don't have that. They are standalones. Stat is a standalone, and so I may have a few more resources than Karen does, but we don't have a network of people we can go to internationally.
which is why I've talked to some people in this room.
I hate asking a question, but I'm going to, just because I have spoken to every one of you probably about Ebola, but probably about other topics as well. And one of the things I wonder about is each of you has developed so much expertise that a bunch of times when we're talking on the phone, I want to turn around and say, what do you think of this, Helen? Like, Lena, do you think this is going to go in a certain... And so the question is, how do you as a journalist play the ball of, I'm calling the balls and strikes, I'm talking to the experts, versus the fact is, you guys all have more expertise than most experts on most of these topics because you've been thinking about this and writing about this for a long time. So how do you weigh your personal expertise and experience versus the experts? I realize you can't quote yourself in those stories because you are journalists, but was that a struggle? Is that an issue you grapple with, and how do you do it?
I just think it helps you frame the story.
Yeah.
Like, if somebody's telling me something that I know is patently untrue, then it's just like, okay, that person's not a good resource for this information. It helps me see what the story I should be writing versus the story that maybe other people are writing. Like I can listen to a briefing sometimes and hear people talking about things, and I think, okay, but what's really important here is the trend is going this way or that way, and that it just helps you figure out how to take an approach that maybe not everybody else is taking.
Right. It's about framing, and also then you can pick and choose. Well, that's actually not the story. That's not what I want to spend my time doing, because there's nothing new in what these people have said. It's the same old stuff.
Yeah, so for me, I see it as like the best stories I write and the best reporting I do is when I can understand all the details so clearly. All the puzzle pieces are falling into place in my mind. And then that enables me to step back and write something that's really broad and generalizable. So yeah, I see it. And for radio, being really, really having a lot of deep understanding is really bad. And I have to fake that I don't understand things to get people to say things in a simple way. Because the radio needs to be super, super simple. So I've struggled with that, pretending to be really dumb when I talk to people on the phone. But no, I'm serious. It took a while. But for me, I see it as a real asset to have all those puzzle pieces in place, because then you can make more general, broader statements you can't make if you don't understand it. That's how I see it. I see it as an asset. I don't see it as detriment at all. I see it as more the ability to show every side and show it in a way that's understandable.
Thank you. Next question.
Hi, Mark Lipsitch from Harvard School of Public Health. Thanks for a great panel. I wanted to pick up on sort of a theme that Michaeleen raised, and some of you have also touched on, about the question of sort of reporting the public health authorities' good advice versus questioning what the motives and justification behind that are. So if it's vaccines, probably everybody in the room agrees there's a valid point of view and a invalid point of view. And you may choose to report both, but you're not going to give them equal time. At the other extreme, with some of the public health authorities in New York and New Jersey doing silly things, maybe they didn't agree with them, but they did them, the public health people, and quarantining for Ebola, then it's clear that you can present a critique. Right. And I'm curious about the kind of middle ground where there seems to be legitimate disagreement, but it's hard probably to tell what that is. And the example I would give is maybe the importance of agriculture in antibiotic resistance, which many people think is absolutely central and some people think is quite the opposite. But you don't have to take that example. Just how do you mediate between trying to pass on good public health advice and being independent and questioning?
My job is not to do the job of the CDC, right? So the CDC, when you talk to them about flu, it's like, get your flu shot, here's why vaccines are important. That's fine.
Buy an ad.
Right, buy an ad, right? I'm not part of your team. My team is to our readers and the mission of our news organization, which is independent. Yes, I will write about, but so my take will be, well, what is going on with flu this year? Is there something about the vaccine? How are you going to do your public messaging this year to capitalize on this really bad flu season? And you know, what is new? I will include, for example, separately as a separate story, here's a Q&A, what you need to know about flu this year. I mean, I did one last year because flu was so bad. And a lot of that was taken from the CDC website and talking to doctors. That was basically, you know, when you should get your shot and different kinds of shots. But in terms of reporting, that will depend on what I independently judge to be the news and what's reliable. Antibiotics in agriculture, huge thing, huge deal. But to get to that story is much harder because that data is not public. The agricultural industry is not going to say, hey, let me show you how much we give to the pigs. And to really get at it is very, very hard. And that's probably why you don't see as much of it, and it takes a lot of time.
So we end up
and a lot of FOIAs.
We end up not covering those issues for the most part. There are one or two. Maren McKenna has done.
Yeah, she's done
great work
terrific
on
work,
that
right.
topic.
Can I just ask, Mark, are you in the it's not that big a deal?
Yeah, I'm on the it's not that big a deal.
Okay. Well, let's talk.
Actually.
I don't
In the
think
developed world, at least.
Sorry?
At least in the developed world.
Okay. I don't have a good answer for you. I mean, I think I understand what you're talking about, and I can think of another example, like maybe about 10 years ago, there was maybe New York Magazine did a piece, I can't remember where it was, but it was somebody did a magazine piece on how bad flu shots were. And it was kind of before everybody else embraced the notion of how bad flu shots were, and I was like scandalized because it seemed like how, irresponsible. But now I'm kind of where the writers of that piece were then. So, sometimes your understanding of things evolves, and the more people you talk to, you don't end up always in this place you were in when you started.
So, like in journalism, the deadline has come. Our 800 words are written. Sorry, I can't take your last question. Thank you, everybody. I'm going to hand it back over. First of all, let's thank our panelists, of course.
Okay.